Hi, I'm Joyce Schultz-Killian, a registered nurse for 27 years and in healthcare since I was 18 years old. I'm the owner of At Your Request Patient Advocate, LLC. I'm here at your request because I am your private patient advocate, helping you navigate healthcare one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm hoping to give you the tools you need to be your own best private advocate. Find me on Facebook at Your Request Patient Advocate and on Instagram at JSKICURN. Hi, everyone. It is April 18th, 2021. I felt like I owed everybody an update to the COVID-19. The 3 podcasts that I uploaded on the 14th of April, 2 of them were from 2019 and 1 of them was from March of 2020, and that was the COVID one. So I thought that I owed everybody an update to the COVID-19. So as of April 18th, 2021, I do have to say that I am fully vaccinated and I am feeling a huge heavy weight off of my shoulder. I know that my clients, their family members are all relieved as they get their COVID vaccines. We are all feeling a little bit of that weight off of our shoulders being taken off. The thing that I'm not doing is I'm not letting down my guard. I still carry my alcohol spray bottle in my car, and I'm constantly spraying anybody who gets in my car, their hands, not them personally. When they get out of my car, I spray my seat. We know it's not spread so much by contact. I'm still wearing my mask, not in my car so much, but when I'm out, when I'm with people, I'm still washing my hands. I'm still taking all of those precautions that I was taking prior to being vaccinated. Yes, I've gone out to dinner once now. I've gone out to breakfast once. It was very pleasurable, but I didn't let down my guard. I know that I'm still susceptible. I know that I got the Moderna, and there's still a percentage of chance that I could still get the illness and the virus and then pass it on to other people that aren't vaccinated. So I am being prepared and still taking precautions. I also was getting tested every week up until probably about middle of March when I stopped. And that's what I want to talk about. I want to talk about the March 13 guidelines that came out from the Center for Medicare and Medicaid Services. On September 17th, 2020, they put out a release saying that, now they were going to open up facility visitation to just essential visitors in times of hospice or where essential visits would be necessary. I was still not allowed into facilities at that time. So on March 13th, a new guideline came out, March 10th, actually, 2021. The Center for Medicare and Medicaid Services, not IDPH, not Illinois Department of Public Health, but they came out with saying that enough was enough. We are guiding towards now being vaccinated. Most of our communities are fully vaccinated. Employees who choose not to be vaccinated, I do not believe should be held as a penalty if they get COVID to any of the family members or the community residents who have been vaccinated. So let's talk about these new guidelines. So the new guidelines came out on March, I thought it was the 13th, but it looks like the 10th. I saw them on the 13th, and it talks about opening up the facilities. And in here it says fully vaccinated refers to a person who is greater than 2 weeks following receipt of the second dose in a 2-dose series or following 2 weeks in the receipt of a single dose vaccine per the CDC's public health recommendation for vaccinated person. I am 2 weeks past. I am almost a month past now, actually, and quite excited about that. So the indoor visitation policy has changed, and what the policy now says is facilities should allow indoor visitation at all times and for all residents, regardless of vaccination status, except for a few circumstances, when visitation should be limited due to a high risk of COVID-19 transmission. Note, compassionate care visits should be permitted at all times. These scenarios include limiting indoor visitation for unvaccinated residents. If the nursing home's COVID-19 county positivity rate is greater than 10%, we don't have any county that is greater than 10% in Illinois that I am aware of, and that greater than 70% of the residents or under 70% of the residents in the facility are fully vaccinated. I don't know that that is true anywhere either. The problem comes where the employees choose not to be vaccinated, because we know that there's a lot of employees out there, or employees out there who don't want to be vaccinated. And I've seen it with the flu vaccine at the hospital. I've seen it with the H1N1 vaccine at the hospital. I see it everywhere. There are the anti-vaxxers who don't believe that, they should take their responsibility and protect other people, that they owe it to the public health of the United States and where we live to other people to be vaccinated and protect them. We know vaccinations work. The science is there. That's not even being debated here. Indoor visitation would also be limited if resident with confirmed COVID-19 infection, whether vaccinated or unvaccinated, until they have met criteria to discontinue transmission-based precautions, which would mean they would be quarantined, or a resident in quarantine, whether vaccinated or unvaccinated, until they have met the criteria from release for quarantine, which is the 14 days fever-free, symptom-free. So it says facilities should consider how the number of visitors per resident in one time and the total of visitors in the facility at one time based on the size of the building may affect the ability to maintain the core principles of infection prevention. So that's the thing. Let's limit them, limit the amount of people. Let's still reduce. Let's keep our social distancing. Let's do that. But my understanding still is the facilities, a lot of them aren't understanding these new guidelines, and it just is really very frustrating to me. IDPH, they're saying that they're waiting for the CDC and IDPH to come out with guidelines. Why didn't the Center for Medicare and Medicaid, the Center for Medicare and Medicaid Services, talk to IDPH? Why are they putting out this standard? They know that the communities are suffering. They know the people in the communities are suffering. Why they didn't talk to the Illinois Department of Public Health? Well, that's a federal organization, Center for Medicaid and Medicare. So they would have to go to each individual public health department, which would probably be impossible. But they sent out these guidelines knowing that the communities were vaccinated and people were taking the precautions still that they needed to. The problem is the communities don't want us in there. They've become very complacent to the fact that we are not in their buildings, and they're very happy about that. They don't want us in there. They have gotten very complacent. They don't want us seeing what's going on. They just want to be left the way they are, which is not being investigated, not having anybody allowed in. They like that. They like being able to do what they want and nobody seeing it. Letter received regarding links to the information. So that's what I'm doing. So when I get in touch with a family who says that their visitation has been decreased, or they're still not being allowed in the facility and their family member is fully vaccinated and they're fully vaccinated, I write a letter to IDPH and the Ombudsman, and I just say, hi, I have a person at so-and-so facility, community, and they're not allowing visitors. My understanding is March 13th, new guidelines came out. Can we please educate them on how these guidelines affect them? And then the next couple days, I get a notice from my client that says, hey, oh my gosh, they're decreasing the boundaries. I recently had a person, one of my client's spouses, who was waiting for his second vaccine and the 2-week period to pass so that he could see his wife, who he has not seen since October, or spent any quality time with since October 27th of 2020. 20. So he made an appointment for April 26th to go see his wife. They told him that he would have to meet in the library and socially distance. He wouldn't be able to hug or touch her. He was like, oh my gosh, how is this going to happen? She's immediately going to want to come and hug me, ask me, wait, hey honey, why can't I get a kiss? And, he didn't understand. He's fully vaccinated. She's fully vaccinated. This is 2 weeks from now. What are we waiting for? Why is this still happening? So I shot off a letter to IDPH and the ombudsman for the area that we were talking about. And within 2 days, he got a notice that went out to everybody at the facility, all of the family members from the facility who have family members there, that said, we realize what a burden this has been. So we are taking it upon ourselves to remove some of the restrictions, which is absolute bull crap. They are not doing that themselves. It was because an email was sent out and somebody finally educated them. I have a couple of facilities that really surprised me. One in Lincolnshire that does allow me to go in and sit with my client. We're both vaccinated. They do ask that we keep our masks on. When everybody else leaves, I let her pull her mask down. I leave my mask on. I'm usually double masked. I usually have a surgical mask, a regular surgical mask on, and then I have my cloth mask on over it. Again, I don't want to infect anybody. And my client's already had COVID, and she's also received her vaccines. So let's see, what else did I want to... I wanted to talk about that during a Zoom conference, I was introduced to the community liaison for IDPH for the Illinois Department of Public Health. I had her name. I've also worked with several other people from the Illinois Department of Public Health, the Ombudsman Program, and from Illinois.gov, several people who oversee the assisted living program. That was a huge controversy in the very beginning. I think I might have talked about it in the last COVID presentation I did, but there was a lot of misrepresentation, or they would say that doesn't, the facility would say that doesn't involve us because we're a memory care facility, we're not assisted living. And then I would call Linda Kovaric, who oversees all of the 500 plus assisted living facilities in Illinois, and she'd say, no, that is an assisted living. So then I would guide her to them, and, I'm not sure if she actually talked to them or not. But during this Zoom conference that I was on with, I believe, Illinois Continuity of Care organization that I belong to, I was introduced to a community liaison for IDPH, and she was supposedly the person that goes into all of the communities, not like a Linda Kovaric who oversees all of the communities, but she is the liaison who supposedly knows all of the rules and regulations. I offered to assist with this was well before March when the new guidelines came out. This was probably in January or February. I sent an email to her, to IDPH. I always tag Governor Pritzker in it, his executive assistant. Again, I've been very active over the last 14, 15, 16 months trying to figure out how to get through this pandemic, how to make it easier for the community members of my senior communities that were having difficulty, that couldn't see their family members, that didn't understand why a window visit was necessary, why that person couldn't come in. So I have been involved in this for this last 15, 16 months that we've been doing this, and threatened several times to go down to Illinois State and, or where Governor Pritzker was speaking, and let him know that, hey, this isn't the way, what you think is happening is not what's happening. People are being locked out. Family members aren't being allowed in. The visits aren't going like you say they should. Family members aren't allowed to be able to see their family members as much as you say, even if it's via FaceTime or a duo call or something like that. I've pulled so many times to view a therapy session. And I've seen therapists walk into my clients and say, "Hi, do you want to have therapy today?" And them say no. And them say to me, "Well, there, I tried." And I'd say, "Really? This is this is your attempt at trying?" So again, I offered to the community liaison for IDPH, to Linda Koverick, to some big name people, to help them, to offer during this pandemic relief, to help them decide on what kind of introduction they were going to have to communities, to help them develop a plan for communities, and then to develop a plan so that this never happened again, so that we wouldn't be locked out of communities again, and we wouldn't have family members that couldn't see their loved ones for 14 months or be with them when they died or be there to just give support. So much of that is underrepresented in the senior community. They don't have a voice. Some of my clients couldn't speak for themselves. I know that. I know the clients that couldn't speak for themselves were suffering. I saw them suffer. And I want to prevent that from happening again. So we've been through this. Now let's go and let's change what we can do the next time this happens. I don't want to see the seniors suffering or the family members suffering or anybody suffering during a pandemic like we did before. We have the education now. We know better. Let's do better next time. On that note, I never heard from anybody. I resent the email. I sent it with a delivery receipt. I saw that it was delivered to everybody. I always send it with a read receipt. I saw that it was read by some people. I saw that some people deleted it without reading it. My letter to offer to assist in a solution. Never heard back from anybody. That's very disappointing to me. But I am making myself more aware. I am voting more these days, making myself aware more politically what's going on, and trying to make myself more aware and make those changes that we need to see a difference in the communities and the way our seniors are taken. United States is one of the most disappointing nations in the world on how we treat our elderly population. We really do not give them the respect that they have endured and earned over their lifetime. My biggest take from all of my clients is what they give to me. I tell them, I often tell people that I learn more from them than they would ever learn from me. I had a client that was in World War I or World War II. He was an air fighter pilot. I just have learned so much from all of my clients, and don't ever want to see them suffer like this again, or the families of these patients suffer, these clients suffer. Not at all. So that's my COVID update. I, again, want to tell people, I know there are a lot of people that don't believe in COVID, that think it's a big sham. I was part of the H1N1 crisis. I took care of the clients on the weekends when I worked the night shift in ICU because my children were away with their dad. I know what it was like. I got my H1N1 vaccine. I get my flu vaccine every year. I've been relatively healthy. I got my COVID vaccine. Second one knocked me on my ARSE. Just really, me and the advocate that I had working for me, both were out the next day. I at least made it till 11 o'clock in the morning and got through one appointment, but she did not. So I know what it's like. I don't want to see anybody go through that. I know there are people that don't believe it in the vaccine. And I'm just trying to educate people. Believe in the science. We don't have polio anymore. We don't have measles, mumps anymore. Whooping cough is making a comeback because some people don't get vaccinated anymore for whooping cough. And there are the anti-vaxxers out there that just believe that it causes autoimmune diseases and things like that. These RNA vaccines are the closest key or locking key that we can get to having an answer to this virus. I heard recently that they were looking at possibly a vaccine for HIV, which would be amazing. I remember when HIV first came out and people were just scared, and we have come such a long way since then. The RNA vaccines are tailored to be the locking key to fit the virus, so there's little area for error in that vaccine, why they're so comprehensive and cover so much. So again, that's my update on COVID-19. It is April 18th, 2021. I hope people are taking this serious because we are having a resurgence. I got very scared in April in the last couple weeks as I saw I'm part of Siren, and as I saw the rates going up into the 4.9, and then we hit 5 again. We had more deaths in one day than we had in since 2020. So it was getting very scary. So I'm hoping that people take this serious, still maintain the precautions, and that when the vaccine's available to you, you get it. So on that note, I would like to thank you all for listening. If you like what you hear, please hit the follow button and tell your friends. I would like to thank everyone who helped me to take the plunge, not only to do this podcast, but with every dream I've had in the past 8 years. Thank you, Gunnar Collins of Collins Backflow Specialist, shameless plug, yes, for supporting my every dream. Remember, I am your private patient advocate, and I'm here at your request to help you navigate the healthcare system, one puzzle piece at a time, by communicating, educating, and advocating with and for you. I'm here at your request because I am your private patient advocate. Find me on Facebook at Your Request Patient Advocate, and on Instagram at JSKICURN. And hit like and follow if you like what you hear. Thanks and have a great day.